Breast cancer affects millions of women worldwide. It occurs when cells in the breast grow uncontrollably, forming a tumor. These tumors can spread to other parts of the body. Understanding its types, symptoms, and treatment is crucial for early detection. With advancements in technology and awareness, there is hope for prevention and successful treatment. Early detection plays a vital role in improving outcomes. Remember, breast cancer is treatable with the right support and care. Breast cancer is not a one-size-fits-all disease. There are different types of breast cancer, each with its own characteristics and behavior. Understanding the various types is crucial for determining the most effective treatment approach. One common type is ductal carcinoma in situ, where abnormal cells are found in the lining of the milk ducts, but have not spread to nearby tissue. Another type is invasive ductal carcinoma, the most common type of breast cancer, where cancer cells originate in the milk ducts and invade surrounding breast tissue. Invasive lobular carcinoma, on the other hand, begins in the milk-producing glands or lobules and can spread to nearby tissue. Other less common types include inflammatory breast cancer, triple-negative breast cancer, and Paget's disease of the nipple. Each type of breast cancer has its own set of characteristics, growth patterns, and treatment options. Consulting with a healthcare professional is essential for accurate diagnosis and personalized treatment planning. Early detection is paramount when it comes to breast cancer. Being aware of the signs and symptoms and seeking prompt medical attention can significantly improve treatment outcomes. It is important to note that not all individuals with breast cancer will experience symptoms, and some symptoms may be indicative of other conditions. One of the most common symptoms is a lump or mass in the breast or underarm area. This lump may feel different from the surrounding tissue and may be painless or tender to the touch. Other symptoms include changes in the size or shape of the breast, such as swelling, shrinking, or dimpling of the skin. Nipple changes, such as nipple discharge, inversion, or a rash around the nipple, can also be indicative of breast cancer. Pain in the breast or nipple, redness or thickening of the breast skin, and swollen lymph nodes under the arm are other potential symptoms. It is crucial to remember that experiencing any of these symptoms does not necessarily mean you have breast cancer. However, it is essential to consult with a healthcare professional promptly to rule out any serious conditions. The exact causes of breast cancer are not fully understood, but a combination of genetic and environmental factors is believed to play a role. Some risk factors are beyond our control, but others can be modified through lifestyle choices. Family history is significant, as women with a first-degree relative who has had breast cancer have a higher risk. Genetic mutations such as BRCA1 and BRCA2 can also increase susceptibility. Age is another important factor, as the risk of breast cancer increases with age. Lifestyle factors such as obesity and lack of physical activity have been linked to an increased risk. Having risk factors does not guarantee developing the disease, and many individuals with no known risk factors develop breast cancer. Section 5. Diagnosis. Unveiling the truth. Diagnosing breast cancer involves a combination of tests and procedures to confirm the presence of cancer cells and determine the stage and type of the disease. Early diagnosis is crucial for effective treatment planning and improving outcomes. The first step in diagnosis is often a clinical breast exam, where a healthcare professional physically examines the breasts and underarm area for any abnormalities. If a lump or other suspicious finding is detected, imaging tests are typically ordered. Mammography is a specialized X-ray that can detect breast cancer in its early stages, even before a lump can be felt. Ultrasound uses sound waves to create images of the breast tissue, helping to determine if a lump is solid or filled with fluid. If cancer is suspected, a biopsy may be performed to remove a small sample of tissue for examination under a microscope. Other tests, such as magnetic resonance imaging or MRI and positron emission tomography or PET scans, may be used in certain cases to provide more detailed information about the extent of the cancer. Section 6. Staging, determining the extent of the disease. Once breast cancer is diagnosed, staging determines the extent of the disease and guides treatment. The TNM system stands for tumor, node, and metastasis. T describes the tumor size, N indicates lymph node involvement, M indicates metastasis to distant organs. Stages range from non-invasive stage 0 to stage 4 where cancer has spread. Staging helps determine prognosis and treatment. Section 7. Treatment options, a multifaceted approach. Treatment for breast cancer is tailored to each individual's specific situation, taking into account the stage and type of cancer, overall health and personal preferences. Treatment options may include surgery, radiation therapy, chemotherapy, hormone therapy, and targeted therapy. Surgery is often a primary treatment option for breast cancer and involves removing the tumor and surrounding tissue. The extent of surgery varies depending on the size and location of the tumor, as well as whether cancer cells have spread to nearby lymph nodes. Radiation therapy uses high-energy rays to kill cancer cells or stop them from growing. It may be used after surgery to destroy any remaining cancer cells or as a primary treatment option in some cases. Chemotherapy involves using drugs to kill cancer cells that may have spread throughout the body. Hormone therapy is used to block the effects of hormones that can fuel the growth of some types of breast cancer. Targeted therapy uses drugs that specifically target cancer cells, interfering with their growth and spread. Section 8. Navigating the complications, a guide. While treatment for breast cancer can be highly effective, it is essential to be aware of potential complications that may arise. Understanding these complications can help individuals make informed decisions about their care and manage any side effects effectively. Surgery can sometimes lead to complications such as infection, bleeding, pain, and lymphedema, a condition that causes swelling in the arm or hand. Radiation therapy may cause skin irritation, fatigue, and, in rare cases, damage to surrounding tissues. Chemotherapy can cause a range of side effects, including nausea, vomiting, hair loss, fatigue, and an increased risk of infection. Hormone therapy can lead to hot flashes, vaginal dryness, and bone loss. It is important to discuss potential complications and side effects with your healthcare team before starting any treatment. They can provide guidance on managing side effects and address any concerns you may have. Section 9. Prevention, empowering yourself. While there is no guaranteed way to prevent breast cancer, there are steps individuals can take to reduce their risk and promote overall breast health. Adopting a healthy lifestyle is crucial, including maintaining a healthy weight, engaging in regular physical activity, and limiting alcohol consumption. Eating a balanced diet rich in fruits, vegetables, and whole grains is essential, while limiting processed foods, sugary drinks, and unhealthy fats. Breastfeeding, if possible, has been shown to have protective benefits against breast cancer. Regular breast self-exams are encouraged to become familiar with your breasts and notice any changes. If you notice any unusual lumps, discharge, or other changes, consult with your healthcare professional promptly. Genetic testing may be recommended for individuals with a strong family history of breast cancer or other risk factors. This testing can identify mutations in genes that increase cancer risk, allowing for personalized prevention strategies. Section 10. The importance of early detection screenings save lives. Regular breast cancer screenings play a vital role in early detection and improving treatment outcomes. Screenings can detect cancer before any symptoms appear when it is most treatable. Mammography is the most common screening test for breast cancer and is recommended for women starting at age 40 or earlier for those with increased risk factors. Regular mammograms can detect breast cancer in its early stages when treatment is most effective. Other screening tests, such as breast MRI and clinical breast exams, may be recommended for women at high risk of breast cancer. Talk to your healthcare professional about your individual risk factors and the appropriate screening schedule for you. Early detection through regular screenings significantly increases the chances of successful treatment and survival. By staying up to date with screenings, individuals can take a proactive approach to their breast health. Section 11. Conclusion: knowledge is power. Breast cancer is a complex disease that affects millions of women worldwide. Understanding the different types, symptoms, causes, and treatment options is crucial for early detection and effective management. By being aware of the risk factors, adopting a healthy lifestyle, and staying up to date with screenings, individuals can take proactive steps towards better breast health. Remember, knowledge is power when it comes to breast cancer. By educating ourselves and our loved ones, we can break down stigmas, promote early detection, and support those affected by this disease. Together, we can make a difference in the fight against breast cancer.